Allopathic medication, part 10. Len found improvement in the symptoms and signs of scurvy among the group of men treated with lemons or oranges. He published a treatise describing the result of his experiment in 1753. As an early critique of statistical methods in medicine was published in 1835, the term evidence based medicine was the term evidence based medicine was the term evidence based medicine was introduced in 1990 by Gordon Goyot of McMaster University, an early critic of the statistical methods of medicine in published 1835. Well, the term the clinical decision making. Alvin Feinstein's publication of Clinical Judgment in 1967 focused attention on the role of clinical reasoning and identified biases that can affect it. In 1972, Eshi Cochrane in 1972, Eshi Cochrane published Effectiveness and Efficiency, which described the lack of controlled trials supporting many practices that had previously been assumed to be effective. In 1973, John Weinberg began to document wide variations in how physicians practiced. Through the 1980s, David M. Eddy described errors in the clinical reasoning and gaps in evidence. In the mid 1980s, Alvin Feinstein, David Sackett, and others published textbooks on the clinical epidemiology, which translated epidemiological methods to physician decision making. Towards the end of the 1980s, and group at Rand showed that large proportions of procedures performed by the physicians were considered inappropriate even by the standards of their own experts. Evidence based guidelines and policies. David M. Eddy first began to use the term evidence based in 1987 in workshops and a manual commissioned by the Council of Medical Specialty societies to teach formal methods for designing clinical practices guidelines. The manual was eventually published by the American College of Physicians. Eddy first published the term of evidence based in March 1990 in an article in the Journal of the American Medical Association that laid out the principle of evidence based guideline and population level policies, which Eddy described as explicitly describing the available evidence that pertains to a policy and tying the policy tying the policy evidence instead of standard of care, and instead of standard of care practices or the beliefs of the experts, the pertinent evidence must be identified, must determine whether the policy is justified by the evidence or not yet so. A rationale must be written. He discussed evidence based policies in several other papers published in JAMA in the spring of 1990. Those papers were part of a series of 28 published in JAMA between 1990 and 1997 on formal method for designing the population level guidelines and policies.